Do you want to reduce the rush in your clinic, OPD, or hospital setup or diagnostic lab without reducing the total number of patients? Then this is the video for you. Hi, my name is Dr. Nitin, and I help doctors, clinicians, and healthcare business owners to grow their clinical practice and healthcare business with the help of various tips, tools, ideas, and strategies. So, if you are new to this channel, please subscribe to this channel and please do share this channel with your team members so that they also understand and get ideas from this channel to improve their clinical practice. So, today we are going to talk about how you can reduce the rush in your clinical setup, your hospital, clinic, OPD, or any diagnostic lab center without reducing the actual or the total number of patients. So, if even if you have not thought about this, watch this video and you will walk away with certain ideas today at the end of this video, which will help you to improve your clinical practice and grow it at an exponential rate. Today's video is going to be slightly longer, uh, and please do not skip any part. You never know, you will not uh, your idea will give you a certain benefit which can help you a lifetime. And watch this video till the end, though the video is going to be long, but I'm not going to compromise on the quality. So I'm going to share you some certain tips and ideas which will definitely help you in your clinical practice. So if you are not subscribed, please subscribe and let's get started with today's topic. Uh, and let's understand how we can do it together. Okay, so to begin with, let's first understand what are the actual benefits of reducing the rush in your medical OPD, clinic, or hospital setup, that too without reducing the total number of patients. So there are several benefits. To begin with, it will give you enhanced patient experience with reduced rush. The patients can experience shorter wait times, allowing for a more comfortable and less stressful environment during their visit. Then it can help you improve the quality of care. Any healthcare providers, doctors can allocate more time and attention to each patient without being feeling of rushed or leading to more thorough assessment and better communications with higher quality care and delivery. You can have increased patient satisfaction. Patients are more likely to be satisfied with their healthcare experience when they feel that their concerns are adequately addressed and they receive personalized attention from the medical staff, including the doctor. It can give you better patient outcomes. When healthcare providers, doctors have more time to dedicate each patient, they can better identify and address underlying health issues, which can lead to improved treatment outcomes and recovery rates. It can also help you to reduce the risk of medical errors, because what happens when you are rushed, uh, there is more increase in the likelihood of errors in the diagnosis, treatment, and medicine administration. By reducing rush, as a doctor, you can reduce the or mitigate this risk and ensure safer patient care. You can provide enhanced provider well-being. Healthcare professionals, as a healthcare professional, you often experience stress and burnout when faced with high amount of patient volumes and time constraint. So by reducing the rush, you are allowing you and your team members to work at a sustainable pace, leading to improved job satisfaction and overall well-being. So you can have an optimized workflow by managing patient flow more efficiently and reducing the rush. your facility can streamline your day-to-day clinical operations, leading to better resource utilization, reduced congestion, and improved overall workflow. Another benefit is that you can increase your revenue potential. While reducing the rush may initially seem counterintuitive to maximize your revenue, it can lead to improved patient retention and attraction. And those satisfied patients are more likely to return for future appointments with you and recommend your clinic or hospital or diagnostic lab to others, which ultimately contributing to long-term revenue growth. If you found this one point itself useful, please give a like to this video. It can also give a benefit of better compliance with appointments. Patients are more likely to show up for appointments and follow with treatment plans when they feel valued and respected during their interaction with the healthcare providers or doctors or your staff. Hence, reducing rush can contribute to higher appointment attendance rates and better patient compliance. I'm sure you must not have thought about this. I'm very much sure. Not only this, it can give you a positive reputation. A medical facility is known for providing attentive, high quality care in a relaxed environment is more likely to earn a positive reputation within that community. And this reputation itself can attract more patients. So, my dear friends, do you understand that what I'm saying here is that by reducing or basically managing the rush, you are attracting more patients and growing your clinical practice. And it can help you in a long run success of your clinical setup. So by implementing certain strategies to reduce rush without decreasing the total number of patients, your facility, your business can improve both the patient experience and the quality of care delivered to your patients. And it will not only benefit your patients, but you, your staff, and the whole hospital or clinical setup as an organization as a whole. So, my dear friends, if you found this information till now useful, please give me a like and please do share, subscribe to my channel. And if you feel that this information is really helping you and guiding you, please share this with your friends, colleagues, so that they also understand and it benefits them. So I'm not done yet. I still need to talk about how you can actually do it. So let's understand how can you actually do it. So reducing rush in medical facilities requires certain strategies. So here are the some of the ways to achieve it. So you can implement appointment system or you can enhance it. So by implementing an efficient appointment scheduling system that allows patient to book appointments in advance, hereby reducing the walk-in traffic and minimizing the wait times. You can utilize technology for online appointment booking platforms like telemedicine services to streamline these processes. You can use community health promotion as such. You can launch community health promotion campaigns to educate the public about preventive healthcare measures and the appropriate use of healthcare services. You can encourage individuals to seek care from primary healthcare centers for non-emergency issues, thus reducing the burden on hospitals and clinics. Now, some of you may feel that you are rejecting or denying or delaying those patients, but my dear friend, let's understand that you can have your primary care setups created at the point of contact. You don't have to worry about those patients are leaving you, right? I'll share some more techniques or ideas which will help you to improve the patient management. You can have your mobile clinics and outreach programs which will help you to extend your healthcare services to areas and communities which are underserved through your mobile clinics and through your outreach programs. So, by providing preventive care, screenings, and basic treatments in remote areas, the demand for your hospital based services can be reduced. You are still maintaining or having that patient, but you are reducing the burden on the secondary and tertiary care setup. That you can have what you call task shifting and skill matrix optimization. You need to train and empower your healthcare staff, workers, such as your nurses and community healthcare workers, to take on expanded roles and responsibilities. By delegating tasks that traditionally performed by doctors and other qualified professionals, such as conducting routine checkup or administering vaccines, the workload on doctors can be reduced. So you are just delegating your some of the tasks and responsibilities to your trained staff, clinical, paraclinical staff. You can create a public-private partnership to foster collaboration between public and private healthcare sectors to leverage the resources and improve access to care. You can utilize public private partnership to establish additional healthcare facilities and expand your service offerings and enhance patient care. You can utilize technology, you can go for technology adoption where you can embrace the digital health solutions such as electronic health records or maybe telemedicine or health applications to improve healthcare delivery efficiency. These technologies can enable remote consultations, patient monitoring, and it will also help you to come at data driven decision making, which will help you to reduce the need for in person visits and easing the rush in healthcare facilities. You can do some of the task automation by implementing automation and digitalization of administrative tasks such as patient registration and billing. You can streamline workflows and reduce the waiting time for patients. This allows healthcare staff to focus on more patient care rather than the paperwork or any administrative work. You can do capacity building. You can invest in infrastructure development and capacity building initiatives in order to expand your healthcare systems ability to handle more patient volume. Building new facilities can upgrade existing infrastructure, and you can recruit additional healthcare professionals in order to meet growing needs of your facility or setup, clinical setup. You can involve community health workers, and you can initiate some community health worker programs which will help you to expand community health worker programs to provide frontline healthcare services, health education, and referrals. You can empower your community health workers to triage your patients and provide basic care and connect your individuals with the appropriate healthcare facilities as needed. You can focus on continuous quality improvement by implementing quality improvements initiatives to optimize healthcare delivery processes and enhance patient satisfaction. You can regularly monitor patient feedback, you can assess their performance, and you can make data driven improvements to address any bottlenecks or inefficiencies in your clinical practice. So, my dear friends, by implementing these strategies, you can effectively reduce the rush in your OPD, clinic, hospital, or diagnostic center while ensuring that total number of patients receiving care is not compromised. This leads to more equitable, accessible, and efficient healthcare system for everybody. So, just by taking this one initiative to reduce the rush in your clinic or clinical setup, you are actually growing your clinical practice. You are not just giving experience or patient satisfaction to your patients, but your team is also getting benefit from this. You are getting benefit from this. So please do think about this. And if you have any questions or any thoughts or any doubts, please ask them in the comment section. I would be happy to answer them. And if you feel that if you need any more personalized or customized consultation or guidance on this, you can always get in touch with me. Uh, so that's all for now, my dear friends. You can subscribe to this channel if you are not subscribed yet, so that you do not miss future tutorials or updates on this channel. So this is Dr. Nitin signing out. Bye bye.